Good morning. I can essentially just reiterate the message from the Chief Executive in terms of the disease that we're dealing with. It's extremely infectious. The only way to contract it is from another person. So the social distancing is absolutely essential. And I would also like to thank the community of the Murrumbidgee Local Health District and New South Wales that have really done an excellent job, and that's reflected in the small number of cases we've had. We are concerned that there are certain hotspots developing, but because of our excellent public health response, contact tracing, and the ability to isolate infectious individuals or their close contacts, will stand us in good stead. There is a bit of good news in terms of vaccine development. There's some promising results out of the UK with a vaccine being developed in Oxford, because until we find a reliable vaccine or a treatment, a lot of these restrictions on our daily lives will remain, because COVID has not gone away, and we unfortunately have seen in Victoria how quickly an outbreak can start and spread. So it really is important that we maintain our vigilance. And as the message is, the reason why these measures are in place is to protect lives. And we've been extremely lucky in Australia with a very small number of people who've passed away. But once again, to young people, one of the cases on a ventilator in Melbourne is a 30-year-old otherwise well person. So sadly, you're not bulletproof. So make sure that you follow the rules and remain safe. Now, there is some media about the wearing of masks. And as I said before, is that this is a rapidly changing environment, and there's been a recent study published in one of the reputable journals about the benefits of wearing face masks, both for people who potentially could be infectious and for other members of the community. Now, mask wearing is not mandated in New South Wales, but it is recommended if you cannot socially distance. The proviso, though, is that you wear the mask appropriately. In other words, you need to perform hand hygiene, either washing your hands with soap and water or using an alcohol-based hand rub to put the mask on your face. Make sure that it's fitting appropriately. And as you would sometimes see in TV shows, masks hanging down from people's neck, it's a terrible habit, and it actually increases the risk of infection. So if you wear a mask, you need to keep it on, make sure that it fits appropriately, and when you remove it, make sure that you don't touch the front, and then once again either wash your hands or use an alcohol-based hand rub to sanitize your hands. Do not reuse disposable masks. If you have a reusable mask, make sure that you wash it and dry it appropriately as per the instructions. So I'll hand over to Adrian Telfer of New South Wales Police, and I'll be available for questions afterwards.